Welcome. Welcome to our launch of Musicians for a Smoke Free Nashville. Nashville is the music capital of the world. It is truly the one and only music city. And the heart and soul of Music City are our musicians. They write our stories, they provide the soundtrack to our lives, and they represent the dreams of so many people who visit Nashville every day. When they're not on stage, many are also the servers at our restaurants, the cooks in our kitchen, and the tenders of our bars. As Music City becomes good to go, it's more important than ever to ensure the health and wellness of those musicians and songwriters who represent us. Musicians for a Smoke-Free Nashville is an initiative to do just that. It is a movement to make all bars, venues, and clubs completely smoke-free as we reopen from this COVID-19 pandemic. We know the vulnerability that smoking and vaping places on our lungs and the attack this virus wages on our respiratory systems. The time has come to extinguish all indoor smoking. So whether they are under the spotlight or under the bar lights, let's make a pledge to ensure our musicians have a safe and healthy space to thrive. As this songwriting and music capital of the world, Nashville, Tennessee welcomes songwriters and musicians from all over the world. We welcome them with open arms and open hearts, and it is now time to assure that we welcome them with 100% guarantee of safe and clean air to breathe. That same clean and safe air that they need to sing and to perform, as well as to be with us in so many other ways throughout Music City, Nashville, Tennessee. Today's webinar is sponsored by Mayor John Cooper and Mary Falls in the office of Mayor Cooper. I'd also like to thank our IT technical team who's with us today, Mr. Kevin Lyons, Mr. John Ferguson, Mr. Michael Kilbane. Thank you. So, smoking, tobacco use, it continues to be Nashville's #1 cause of preventable death and disease, no doubt about it. Smoking, tobacco, and vaping makes our lungs vulnerable. The COVID virus attacks our respiratory system, and it hits our minority communities particularly hard, both tobacco and COVID. So with COVID now in our community and we have to live with it, we should and we must do more, and to do it now, to work with all businesses to pledge that they are committed to a 100% smoke-free facility, indoors and also outside areas that are under their control. We cannot fight COVID effectively if we continue to allow indoor and outdoor environments to be polluted, including the airways and lungs of our musicians, the pearls of Music City. It's time to make a clean break and to say no more to tobacco smoke and vaping in Music City. We can only fight COVID successfully if we do everything in our power to rid this virus from Nashville. And that means eliminating toxic, poisonous tobacco and vaping smoke now. We cannot wait. COVID is waiting at the doorway to creep back into our lungs and into our lives. Let's make a pledge to our musicians today. Let's make smoking and vaping history and celebrate Nashville as a clean and healthy city, the one and only Music City. So today I'm so pleased to be joined by wonderful colleagues. We're going to be hearing from Lillian Maddox Whitehead, who's from our Nashville Metro Public Health Department. She'll be talking to us about the emerging science of tobacco use, lung vulnerability, and COVID-19. Next, the Director of Environmental Health Services, Mr. Hugh Atkins from the Metro Nashville Department of Health. He'll be talking to you about making your workplace healthy. And then I'm really pleased to introduce Mr. Jamie Kent, local here in Nashville, as an artist, entrepreneur, and consultant for Musicians for a Smoke Free Nashville. And then we're really pleased to be here, joined by the president and CEO of the Americans for Non-Smokers' Rights, Cynthia Hallett. She'll be talking about some Pier City examples of success. And finally, we'll be having a question and answer for our webinar attendees led by our own Tracy Buck. So if there's a question and answer box, please start asking your questions right now, and we'll try to answer them during the session. It's my pleasure now to introduce Lillian Maddox Whitehead. Thank you.
Good afternoon, everyone. I'm Lillian Maddox Whitehead, Program Coordinator for Tobacco Prevention, Control, and Use here at the Metro Public Health Department. Just want to give a little bit background about smoking. So we know that each year around 480,000 Americans die as a result of tobacco-related illnesses. And then another nearly 41,000 people die as a result of exposure to secondhand smoke. Secondhand smoke harms non-smokers, and the only fully way to protect non-smokers from smoke is to remove the smoker. Now, a lot of people are concerned about litigation and other issues that can come up, a loss of revenue if you remove the smoker. But smokers are not a protected class. So that's something I really want to express to each and every one of you here today. Secondhand smoke is from a burning tobacco product, such as cigarettes, cigars, pipes, and electronic nicotine delivery systems, which are known as vaping products as well. Secondhand smoke also is smoke that has been breathed out by the person smoking. Tobacco smoke contains more than 7,000 chemicals, including hundreds that are toxic, and about 70 of those are known to cause cancer. And the reason why there are so many chemicals that are in tobacco smoke is because big tobacco add those chemicals to it to make the tobacco products to last longer on the shelf, to get the person more addicted to them. And it could stay in the air long after someone has stopped smoking. So it has been shown in studies that it can stay in the air up to 7 hours. So the health effects in adults exposed to secondhand smoke. Health effects just like for those who do smoke. So heart disease, lung cancer, stroke, and respiratory diseases. Also, it does show that within 20 minutes of a person being exposed to a smoker, that they start, having the health effects of the smoke. Third-hand smoke is something that we rarely hear about, and this is really important to share. We have partnered with numerous daycare centers across the city, with different housing communities across the city to talk about secondhand and third-hand smoke. But third-hand smoke is residual nicotine and other chemicals left on indoor surfaces by tobacco smoke. People who are exposed to these chemicals by touching contaminated surfaces or breathing in the off-gassing from these surfaces. So it can be re-aerosoled if a person touches it. So third-hand smoke, in this image right here, this is an actual apartment of a resident in one of the communities that we had worked in for our Breathe Easy campaign. This person smoked 2 packs of cigarettes a day, and so this shows how third-hand smoke can affect and leave, the residuals behind. So We want to protect people in the workplaces. We want to protect people in their homes. Well, music venues are workplaces. There are workplaces to the musicians, to the folks who work there, who may be servers, to the owners. So we would like to share why this is important for Music City to adopt this policy. So, smoking during the COVID-19 pandemic, we all have heard numerous health organizations across the country, throughout the world, that have shared that this is the right time to stop smoking. And Dr. Caldwell spoke on this, on how it can affect and compromise our lung capacity, our respiratories. So, we just want to reiterate how important it is to make sure that this is a time to stop smoking. The Metro Health Department urges residents of Nashville and visitors to be cautious during this time and continually encourage the residents and visitors to reduce the use of tobacco and other nicotine products to increase the overall health and wellness. Again, lungs are being compromised. If you were to contract the COVID-19 illness, put you in further trouble, okay? MPHD is constantly evaluating and researching public health trends, including links between tobacco use, nicotine use, and COVID-19. So, what recommendations does the Public Health Department have for tobacco users? One of the things that we have been able to do here as a part of our Breathe Easy initiative is that we have been able to offer cessation classes. And so we have been trained by the American Lung Association, by the American Cancer Society, to provide cessation programs to individuals in the city who live in some of the housing communities. And so we encourage people who are using tobacco products during this time to either connect with one of the organizations such as the American Lung Association, the American Cancer Society, and also our 1-800-QUIT-NOW program. This is a free program that is offered by phone or by text. So you are able to call the 1-800-QUIT-NOW, and they will offer 8 weeks of cessation programming. Thank you.
Good afternoon. I'm Hugh Atkins. I'm with Metro Public Health Department, and I serve as the Director of the Bureau of Environmental Health Services. So a couple of things. We are in phase 2 right now of the reopening, and we are under Order 6 from the Director of Metro Public Health, Dr. Caldwell. And a couple of things to mention about Order 6 is that that's where live music started to be dealt with. And also Dr. Caldwell included in Order 6, Section 4, dealing with bars and restaurants, that age-restricted venues should prohibit smoking throughout their premises due to COVID-19's effects on the human respiratory system, as Lillian and Dr. Caldwell just mentioned. The term age-restricted venue, of course, comes straight from the Tennessee Nonsmoker Protection Act, which was passed in 2007, which bans smoking in all indoor enclosed public spaces. However, that act also includes a few exceptions, and age-restricted venues being one of those. If the venue restricts access to their property to persons 21 years of age and up at all times, then they can allow smoking in there. Another quirk to that law and an exception is that if they have outdoor areas, outdoor patios and seating on porches, they are allowed to have smoking out there as long as that smoke doesn't infiltrate back into the areas where smoking is prohibited. And what Dr. Caldwell and Lillian brought up just now is that with the effects of COVID-19, this is another tool that we need to take advantage of because of the hardship, another hardship that it puts on people trying to recover by having to either smoke, if they're smoking, they should stop, but then even having to breathe secondhand smoke when they go into these age-restricted venues that otherwise have an exemption to allow smoking. Some other things I'll run through on how we are actually, as far as the live music is concerned, in Amendment 1 to Order 6, because originally Order 6 restricted the number of musicians in the establishment to 2. So with the amendment, that increased that, but also still kept in place Dr. Caldwell's requirement that they should eliminate smoking in these age-restricted venues. The musicians, entertainers operate under the same guidelines as the property that they are performing in. So when they arrive at the venue, they are to be screened, and temperatures should be taken upon arrival, and they are asked the same questions about symptoms as any employee that is working in the establishment would be, and anybody with a temperature of 100.4 or higher, or anyone who answers yes to the COVID symptoms would be told to follow the recommendations for testing and self-isolating. The management should request periodic testing of musicians to ensure they stay ahead of infection risks. The venues are operating under the same restrictions of whatever phase they are in as far as occupancy of the establishment, and also the crowd size for whatever phase they are in. Venues have to ensure that all musicians, with COVID being a droplet past infection, we have set the distance from the stage to the performers at 15 feet to ensure that we have a little more, we address that risk a little bit more. They are to sanitize the equipment between use and encourage the musicians to bring their own instruments, their own drumsticks, their own mic stands, no sharing of microphones during the performance, and once one group leaves the stage, the other group can't come on till they're clear and everything has been cleaned and sanitized. We want to adhere to social distancing protocols among the performers, and you can do this with either some of them might wear masks if they're not singing, or you can put barriers between the musicians. Otherwise, just spread out on the stage. Dance floors are not prohibited, or are not allowed. Recommend that you fill that space with tables that are appropriately social distanced. And then staff needs to maintain a 6-foot distance between them and the customers unless they are serving them a beverage or a meal. And then we also included some noise restrictions to keep people from having to crowd together to hear anyone. Now, all of those guidelines that I'm talking about are stated in Amendment 1, like I said earlier, and they don't specifically deal with smoking, which we are talking about today, but just in an overall safety of keeping your environment as safe as you can for COVID-19 while we are entering this phase where we allow live performances. And I think it's important to note differences and if people have questions about what the current law is on the Tennessee Non-Smoker Protection Act, we'll be glad to try to answer those as well. The Non-Smoker Protection Act went into effect in 2007, October 1st, and I think it's been really maybe some context on what we're trying to do here. There was a lot of apprehension going into the passage of and the implementation of that act. I was heavily involved in that at the state level at the time, and heard lots of venues express to me that they thought it was going to hurt their business, that their business actually they thought depended on them allowing people to smoke. But then, you know, within a year, when people started getting into compliance and the public started enjoying the benefits of not having to breathe secondhand smoke, after a year of getting into it, it turned to where I was hearing from business owners that they thought it was good for their business to have cut out smoking. And I think that's something to keep in mind when we start talking about what we're trying to accomplish here today. Don't let the fear of driving off some business because you're going to prohibit smoking keep you from doing the right thing here, because you may find out, and I think you would, that this is an encouragement for people to come into your place of business. You will get people that you maybe wouldn't get if you prohibit smoking throughout your entire establishment. So with that, I'll just turn it over to whoever's next.
Hi, my name is Jamie Kent. I am an artist based here in Nashville, Tennessee. I'm a consultant, and I'm the founder of New Nashville Live and the nonprofit People Supporting Artists. It's an honor to be here representing my artist community in this fight for musicians for a Smoke Free Nashville. It's really close to my heart in a lot of ways. And my experience over the past decade feels in a lot of ways like it led me to this moment. Over the past 10 years, I have played over 1,000 shows across the country in every kind of venue you can imagine, from smoke-filled dive bars to Texas dance halls to the Skirmahorn Symphony Center to the Bluebird Cafe. I've seen everything. I've met just about every kind of person you can, and I can tell you from the bottom of my heart that as a musician, as an employee going to work in these venues, it is so important that they are smoke-free for us. The venue has always been my work environment from before I was touring for full-time. I was a server. I was a bartender. I have always been an employee in these venues, and I continue to be an employee in these venues. And that's why it means so much to me. Even today, meetings in Nashville take place at these venues. They take place over beers. That's what I love about this town. It's a relationship town, and all of these decisions, all of these progressions that we make happen at these venues. As I have toured across the country, I've come to see the standard for this industry really has become smoke-free. Most leading cities in the music industry are smoke-free. And so it's the expectation of us as artists that most venues will be smoke-free now. So as a leader, as the music city, I believe it's imperative that Nashville takes that stance, that moves forward and becomes smoke-free in all indoor and outdoor spaces. Why this campaign is especially personal to me, I am an asthmatic, and I have battled asthma my entire life. I have played in smoke-filled venues and had to cancel shows the next 2 days, lost money because of it, battled health concerns, and then come back to play and felt like my performance wasn't at the level it should be for my fans, all because of one show in a smoke-filled venue. Even more personally, my aunt passed away and battled COPD. It has been in my family. I've seen the effects firsthand, and I don't want to see it happen to more people. I continue to avoid booking and playing shows in any venues that are smoke-free across the country. And I'm sure, and I talk to friends and fellow artists within my community, they all agree, and they're all on the same page. So I want to make sure that we as a Nashville community aren't losing shows, aren't losing artists because of that as well. My work with People Supporting Artists, at the beginning of this pandemic, we produced a telethon to raise money for Music Cares and their COVID-19 relief fund. Through that, I was able to come in contact with Cynthia Hallett and the American Non-Smokers Rights Foundation. They supported our telethon. They invested in us in Nashville and the artists in Nashville. And I got to learn what they were doing and learn their cause. And it inspired me to realize that, it's time to shine a spotlight on this old issue. It's time to address it and kind of extinguish it once and for all and really move forward there. I'm inspired by what Cynthia's doing. She's going to speak to it a bit coming up here. But that inspired me to get behind this and help be a driving force of Musicians for Smoke Free Nashville. If you're wondering what you can do, if you're an artist and you want to be a part of this, reach out to me. We'd love for you to be a part of this campaign. If you're a venue and you still are allowing smoking, reach out to us. Ask how we can help. We have the resources to help you transition to smoke-free and not lose any business, gain artist support. We have created a resolution and a pledge that we are having venues sign, and we would love for you to sign it to commit to this pledge. And we're creating stickers for your windows to show with pride that you are a smoke-free venue and have the support of Musicians for Smoke-Free Nashville. So reach out to us, engage us. We want to engage with you. We're in this together. Like Dr. Caldwell said, we musicians with pride feel like we are the heart and soul of Nashville, and we want to return to work. There's so much uncertainty with COVID-19 out there right now that this could provide us some more certainty in these uncertain times, and we would appreciate that support from the community, the business leaders of Nashville, the venues of Nashville. We thank the mayor's office, Dr. Caldwell, the Department of Public Health for helping us lead this charge. And I'm excited to introduce you to Cynthia Hallett from the American Non-Smokers Rights Foundation coming up next. Thank you.
Good afternoon, everybody. My name is Cynthia Hallett, and it's a pleasure to be with you today. I am President and CEO of a national nonprofit organization called the American Non-Smokers Rights Foundation. Very excited to be here because I really do believe that we have an opportunity to make a huge impact on public health and to protect workers. I thank the mayor for his leadership in creating this opportunity for dialogue, and to Dr. Caldwell and his team for bringing us together and providing guidance on the health aspects of this issue as we're reopening in this time of COVID-19 and thinking ahead about the long-term health and safety of everyone in Nashville. Next slide, please. A&R Foundation has over 35 years of experience working with cities and states to clear the air of secondhand smoke. We share our expertise and resources with local leaders and with community partners like Jamie to develop programs that will be effective in your community. We take our experience over the years and hopefully allow all of you to localize what's going to work best as you communicate with your friends and partners and businesses. Next slide, please. To give you an overview of where we are right now, currently 61.1% of the U.S. population is protected by a local or statewide 100% smoke-free law, meaning all workplaces, restaurants, and bars. That doesn't cover venues like casinos, which also are music venues. But for the most part, what you see is that the vast majority of the U.S. population is protected by smoke-free indoor air laws. Unfortunately, if you look at this map, you'll see that Tennessee gets a 0 because while you do have the 2007 statewide law, because of the exemptions, which means that people like Jamie, who has asthma, who's also a musician, could potentially still be exposed to secondhand smoke, which is a health hazard and a trigger for things like asthma and other lung diseases. We understand that some people still smoke, and that's fine. If you, as an adult, decide that you want to smoke or vape, that is your choice, but we ask that you do so in ways that do not harm others by taking it outside and away from areas where other people are gathering. Secondhand smoke and the vapor from electronic smoking devices really are a form of indoor air pollution, and there are carcinogens, toxins, and particulate matter that are easy to inhale deep into the lungs, and it does cause those respiratory illnesses and potentially increases your susceptibility to viruses like COVID-19. Next slide, please. So given that we have these gaps, in August of last year, we put together a report that both highlights the successes and accomplishments in terms of smoke-free protections and looks at where we have gaps in protections. And we feature 12 of the 23 states that are currently not smoke-free states, including Tennessee. Next slide. In this report, we outline some of our traditional educational and outreach activities, as well as suggest creative ways to engage community members and those who are still working in places where they're exposed to secondhand smoke, like working with musicians and music organizations. It's all part of our effort to help put a face on who's still exposed, because remember, with the vast majority of people in the US being protected, a lot of people don't know, or they're not aware that smoking is still allowed in certain places. And when you have exemptions for things like venues that prohibit, minors coming in, there can create confusion for individuals who want to come to Nashville to hear the incredible music, but could have other health issues like heart disease or COPD that really prohibit them from going into these environments that are not smoke-free. As an organization, we have been working with musicians since the early 90s. Before California went smoke-free, we worked with musicians and clubs to have a night to voluntarily smoke-free for an evening. And those evenings turned into weeks, and many of those clubs eventually went smoke-free, because what they found, even in the 90s, was that the vast majority of adults don't smoke, that even smokers will still come to these venues because they love the music, they like the culture of their favorite place, and they can indeed step outside to have a cigarette if they so desire. So believe it or not, we started in California. We've worked with musicians in Austin, Texas, and with many musicians in cities across Louisiana and Pennsylvania and Indiana. And what we have found is that, nobody cares what some of the public health officials want to say about this issue, but musicians are relatable to their fans and to policymakers, because they're real people who are having real problems being exposed to secondhand smoke in their workplace. Next slide, please. So we have had the opportunity to work with individuals, as Jamie said, like himself. We have also worked in the past with organizations like the Baton Rouge Blues Festival, the French Quarter Fest, the Atlanta Blues Society, and others to help, again, expand our message and the audience who is hearing messages about the challenges of musicians trying to perform in smoke-filled venues and the benefit of going smoke-free. This slide here shows you some of the musicians that we have been working with one-on-one during this time of quarantine, when live music venues are closed and they can't make their money doing their gigs, where we are working with them to provide music videos, if you will, and also providing some messaging about, again, the challenges of performing in smoke-filled venues. We have musicians from a number of states like Louisiana, Florida, Virginia, Georgia, Oklahoma, Missouri, and as of this Friday, we'll have our first group from Nashville featured on the program. Next slide, please. So as a national organization, we are available to provide materials, guidance, technical assistance and training, and other resources as you launch your new program, Musicians for Smoke Free Nashville, and any other local work that you want to do in terms of working with residents, business owners, and maybe even policy makers to talk about the health hazards of secondhand smoke exposure and both the health and economic benefits of smoke-free air. As has been stated earlier, with heightened public awareness of respiratory risk factors and the need for healthy environments and looking at individual behaviors, now is a perfect opportunity to assure patrons that businesses are taking every precaution to protect their health from COVID-19 and to remind people about preventing the respiratory risks associated with smoking, vaping, and secondhand smoke exposure. As you can see, we, in terms of our next steps, we will continue to work with our partners in Atlanta. There are at least two communities in Louisiana that are also entertaining either a smoke-free law or working with businesses voluntarily. And of course, we want to encourage hospitality and music venues in Nashville to consider reopening smoke-free. Nashville, as a city, currently is not allowed to adopt a law because Tennessee state law preempts or prevents localities from adopting laws. But business owners have every right to adopt a policy that will protect health and safety of their workers as well as residents and tourists. Again, over 80% of the U.S. population does not smoke. And so you're really opening your doors to more people being able to enter your workplace or your business or club if it's smoke-free. Last slide. I thank you very much. If you'd like to contact us, you may. Otherwise, it looks like there are questions in the chat box. And I thank you and wish you all good health and good luck as you proceed on a Smoke Free Nashville. Thank you.
Well, thank you for everyone who's participated. We're going to be entering our question and answer portion now, and we'll see what kind of questions we have. Tracy Buck here from the Department of Public Health is helping us sort through the questions and answers. But I'd like to thank all of the presenters so far who have presented for us. Thank you so much to Lillian, Maddox, Whitehead for giving us the overview of all of the emerging science on tobacco use and lung vulnerability, especially with COVID-19. Mr. Hugh Atkins for reviewing for us how to make your workplace safe, as well as some of the history of the smoking law in Tennessee and where it currently stands. Jamie Kent for the Musicians for Smoke Free Nashville initiative, and of course Cynthia Hallett, the President and CEO of the Americans for Non-Smokers' Rights Foundation. We're pulling up your questions now, and we'll be able to start answering them as soon as we get them. So I would think maybe we could start our internal conversation a little bit here. What I would ask, maybe Jamie, would you say what are some of the first things, if you could come up and let us know, that you'd like to see in some of the places that you've gone where you're already getting some positive feedback, and places where you think we could use some help?
Some of the places that are really known as legendary venues in Nashville made the transition to be smoke-free long ago. Places like the Bluebird, places like 3rd and Lindsley, they're leaders in our music venue frontier, and we can look to them as examples of we're a music city, we're music first. So when you have that, that leads the way, and people come for the music, they come for the culture, as Cynthia said. I've also spoken to venues like the Five Spot, which is one of the most popular venues in East Nashville and one of the biggest musician hangs that I would say exists in Nashville. And they made the transition from being smoking to non-smoking about 6 years ago. And he assured me and assured any other bar owners that it didn't affect business. In fact, their business got bigger and bigger over the past 6 years. And it's a music town. When you have music, it's music first. And even if you don't have music, even if you're just a bar and you're a dive bar, that's where we hang out. That's where we have our weekends on Mondays, Tuesdays, and Wednesdays. And that's where we work. That's where we serve tables and tend bar, and creating that safe space for us as we reopen. I mentioned so much uncertainty. I think you all probably realize or know somebody that is a musician that has had their whole tour schedule canceled through the summer. There are some things opening up right now, which is great, but we're all uncertain. There's the general news on COVID-19 changes daily, and we don't know, what is right and what feels safe. And so creating a safe environment for us to return to work, that to me seems like foundation of how we can support our music community and support our artists as we move forward and as we reopen and as we become good to go. Yeah.
Thank you so much. That's great information here. Thank you. I thought of a question I'd actually like to ask Lillian, Maddox, Whitehead. Could you tell us, has any time maybe a smoker been able to file a lawsuit to protect them from clean air? Could you comment on that? Sure, thank you.
Thank you, Dr. Caldwell. Through our research with Smoke Free Housing, we have learned that there has been no successful lawsuit that a smoker has been able to file against someone because they were not allowed to smoke. As I mentioned earlier, smokers are not a protected class. And so one of the things that we like to encourage people, when you have individuals who, like Jamie had mentioned, he's asthmatic. And if he's working in one of these music venues, he's complained of smoking. If that was to happen, more than likely he could be successful with the lawsuit versus someone who does smoke and who's wanting to continue to smoke in there, okay? Smokers do jeopardize, the lives of many people. And we know that many of our musicians may not have health care benefits. So we just really want to encourage the adoption of smoke-free venues. Another question, is there a safe way to have smoke-free venues? There is no safe way, as I mentioned before. And we know that with smoking, the smoke travels and can last in the air up to several hours, as I mentioned earlier. It can also go under doorways. It can go through electrical outlets and through the ventilation system. So if you allowed smoking outside on the patio, it could still seep into where the musicians are playing. So there's no safe way except to remove the smoker.
One other question that was asked was that as a musician, do I feel like vaping is a better alternative to smoking indoors? And I can tell you from experience that vaping inside while I'm playing also causes the same effects on my voice. I may not go home reeking of smoke, but I notice that my voice starts going on me in the middle of a show, and that I can't play as long, and that the next day my throat hurts, and it affects my performance, and it affects the show I bring. And so whether or not it seems as obvious, it is also negatively affecting me as an artist and performer if you're vaping indoors. So that's another thing that I would like to put out there and let know, because I know there's a lot of uncertainty there too, and from my perspective, that's my experience.
Thank you, Jamie. A question came in for Mr. Hugh Atkins, our Director of Environmental Health Services. Are establishments required to stop people from smoking in outdoor areas when people under 21 or minors are dining or on the patios? Mr. Atkins?
Yeah, thank you. I think this is a good question to illustrate that while in 2007 we were thrilled with the passage of the Tennessee Nonsmoker Protection Act, because we advanced light years ahead of where we were, where the days of you going in and being asked whether you wanted smoking or non-smoking, and that meant which side of the row of the plastic plants they set you on, and you had to breathe the secondhand smoke anyway. But as was pointed out, while we do have the Tennessee Non-Smoker Protection Act, situations like the question bring up, the outdoor areas the act bans smoking in enclosed public places, and there is an exemption for smoking in outdoor areas as long as that smoke doesn't get back into the facility. So if you take your family out on the patio where they're allowing smoking, the establishment is not legally required to stop the other smokers from smoking out there. That's an exempt area. So that is a prime example of one of the problems with the act. The exemptions provide for areas that people might still breathe secondhand smoke. As Lillian, Maddox, Whitehead pointed out, smoke is very pervasive. We have other exemptions in the act, smoking in hotel rooms that are situated together, but that still can get into areas where smoking is prohibited. And anybody who's a non-smoker, you can walk in and tell whether they're smoking in there, or whether they're actively smoking or not. You're still affected by the residue that's left behind, and it affects your breathing after you leave there. So I think the question does bring out some gaping holes in our Tennessee Non-Smoker Protection Act that 13 years ago we were glad to get what we got, but we're 13 years down this road now, and it's time to maybe consider closing some of those gaps, I think.
Thank you, Mr. Atkins. Another question has come in, and this is for Cynthia Hallett from the Americans for Non-Smokers' Rights. From your experience, where have there been any noted sort of pluses or minuses regarding to the tourism effects when you've seen more comprehensive smoke-free initiatives take hold? If you're able to provide us sort of a context for where we are in Nashville, where we hope to be, and from your experience, what would you predict the tourism effect to be for those venues in Nashville?
Certainly. Well, based on experience, I've been working at the American Non-Smokers' Rights Foundation since 1997, and we heard in the very early days in California and in Hawaii and for other tourist destinations that the tobacco industry myth that if you go smoke-free, you'll lose tourism. And the reality is, given that the majority of the population doesn't smoke, even many international tourists will still come to those destinations because they're coming for the culture, the entertainment, the beauty of the city, whatever the attraction is. And so what we have found is that whether you're an individual business or a city, that business remains the same or increases. And so if you look at a city like New Orleans celebrated a 5-year anniversary of being smoke-free this April. And if anything, tourism has increased because New Orleans is known for its food and music and culture and everything else that is special about New Orleans, and the people still come. And in fact, in New Orleans, they even made their casinos smoke-free, not just the bars and music clubs. And so business continues to do well. People go to the place because they love the place. Nashville is an amazing city in and of itself. I was pleased to be there last May for the Music Biz conference. People will still come to Nashville to hear the music and enjoy the food and the culture. And if anything, business will remain the same or increase.
Well, that's good news. I'd like to ask Jamie to come up one more time and respond what he would see moving forward, and then we'll have some concluding remarks. Thank you. Jamie?
In my dream moving forward, all of the venues and bars that are currently allowing smoking take the step to reopen smoke-free, to be leaders. We are Music City. We are the music capital of the country. Let's lead and take that step forward on our own. As Dr. Caldwell and Cynthia both said, this state law preempts Nashville from making its own law, but it doesn't prevent us from being leaders. And that's right now what we need more than ever, is to lead and take the big step forward, to think of our our health and the health of our neighbors and our loved ones and our musicians above anything else, and trust that the statistics that Cynthia are providing, that Dr. Caldwell and Lillian have provided, that they will hold true, that business isn't going to go down, that it's going to go up, that providing a safe work environment and a safe place for tourists to come back to, that's going to make Nashville more attractive as we reopen. So let's focus on that, and let's move forward, and let's protect our musicians for Smoke Free Nashville.
Thank you, Jamie, and thanks to all of you, as well as to all of our presenters who helped present today, including Lillian Maddox Whitehead from our Department of Public Health, Tracy Buck, also from the Department of Public Health, Mr. Hugh Atkins, our Director of Environmental Health Services, Jamie Kent, now with Musicians for Smoke Free Nashville, as well as Cynthia Hallett, the President and CEO for the Americans for Non-Smokers' Rights Foundation. Thank you so much to help us today with this launch for this new initiative, Musicians for a Smoke-Free Nashville. Nashville is the music capital of the world, and we are going to make it the healthiest music city. Thank you so much. We look forward to seeing you out and about in clean air real soon. Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.org.